Hello everyone, welcome to Young Mission at Crib, and today I will be telling us on three life-threatening conditions that you can actually provide emergency care for. Even if you are not a medical personnel, you can do these things and we sustain the condition, make the condition to proceed to a larger problem, which will now take time to revive the patient back to life or the person back to life. Now, these three life-threatening condition I'll be talking about is fainting, fever, and choking. Fainting means loss of consciousness. Like at that particular time, the person may lose consciousness, which will make the person to fall or collapse, and the person may not know what's happening around his or her environment. So there's something to be done when that a patient is having that kind of condition. Another one is fever. Fever means having a temperature above 37 degree or 37.2 degree, that when you palpate the skin, you discover that the body is hot above normal. And the third one is choking, when there is like a patient is eating and then there's an obstruction in the airway. Let's say part of the food the person is eating obstructs the person's respiratory tract, and the person is gasping for breath like so. That's choking. So now I'll be demonstrating what you do in these three conditions. Okay, now I want to practicalize fully what to do when the patient is fainting and when the patient is, or your sister, your brother, maybe the person just fainted, or your cousin, anybody that is related to you, you're not a medical person, the person fainted, or the person is having fever, or the person is choking. So these are the things we are going to do in respect to these three life-threatening conditions. Now, when the person is having fever, when the reason why we are doing this, why you should do this emergency care for this person before taking the person to the hospital, is because high temperature or fever can result to convulsion in children and can also result to seizure or brain damage in adults. So to prevent this from happening, you have to sustain the temperature or try to reduce it before taking the person to the hospital, where medications can be given to the patient to reduce the temperature. So first of all, for fever, you are going to boil a little hot water. If you are not a medical person, then you don't know what tepid water is. You boil water and you pour it into a bucket. You mix it with cold water. Make sure the water is lukewarm, like is warm, not cold, not hot, just warm. Then you carry a cloth. You can use a towel, whatever you have, cloth. If you don't have a cloth towel, if you don't have a cloth, you can use a towel. If you don't have a towel, you can use a cloth or any clean cloth in your house. Then you dip it inside bucket of water, the bucket of the warm water that you've already mixed, and then you expose the patient. Make sure you pull the patient clothes. You expose the patient, pull the patient clothes. I'm not pulling her clothes because I don't want to expose her body, but you pull the patient's clothes, expose the patient, like open the patient's body. Then you now start to clean up, to damp. What you are doing is that you are reducing temperature by evaporation. When this hotness meets with this lukewarm water, the water on the napkin will absorb the high temperature, so thereby it will be reducing it gradually, or it will not make the temperature to exceed above what it already is before taking the person to the hospital. Let's say prevention, it happens at night and you cannot quickly take the person to the hospital, or before you take the person to the hospital you are taking the person is very far. You can do this for till you finally achieve that the temperature has come down, as in is reduced, before you now take the patient to the hospital. Okay, now This patient just fainted and I don't know what to do. I cannot go to the hospital. Hospital is too far, or it happened at night. I cannot just get through to the hospital, and I'm not a medical personnel, and I want to sustain this patient before the patient revives. So first of all, I will raise this patient's leg so as to allow blood, because now the patient fainted, is unconscious, the heart may be pumping fast just to release blood to vital organs. So because she's unconscious and then the heart is saying there's something wrong, and it's pumping faster. So I'll raise her leg so that there will be blood return back to the heart. Even as the heart is giving that blood, there will be blood return back to the heart. Then another thing again I'll do is I'll expose the patient, like allow pull the patient's clothes. If it's a female, she's wearing singlet, I'll just pull off the thick clothes that is there and allow the lighter one to remain. Then I'll what you do again is, if you have milk, you have tea, even if you have water, you can give to the patient, raise the patient's head up a little, give the patient water, you fan, you allow breeze to get to the patient, you fan the patient, and then patient might regain consciousness. So you do all these things to get the patient back to life, so before taking the patient to the hospital for proper treatment. This is an adult, she's choking and food entered her respiratory tract and she's gasping for breath. So what I'll do is I'll give her an abdominal thrust. Call it abdominal thrust from her waist down to her navel. And then I'll put my hands like this and I'll pull her to myself like this once, twice, thrice, till the food particle falls off from her mouth and she's relieved.